Welcome back, my sisters and possible my brothers, to our third part of our Being Woman series. It is my privilege to now talk to you about the problems associated with menstruation. In this part, we're going to talk about abnormal menses in three parts. One, two, three parts. We are on the third presentation, or rather the third topic, but the third topic is going to be divided into three. So the first topic we're going to talk of abnormal menstruation is menstrual problems, okay? A very broad thing, a very broad topic. Well, it is important for us to understand that regular periods, regular monthly cycle, regular monthly periods, you call that, are a sign that your body is working normally. Okay, so if it's irregular, there's something off there. But if it's regular, then praise the Lord, it is a sort of a thing that, I'm not saying that if you are irregular, you'll never get pregnant, okay? But it just makes it harder to get pregnant. Because I had a friend who was having menses once a year only, but she had 4 children, okay? And there are people who are regular every month and cannot get pregnant. But that's just a fact. Regular periods are a sign that your body is working normally. So you should have regular periods. You should have regular periods unless you are pregnant, breastfeeding, postmenopausal, or have a medical condition that causes your periods to stop. So the only reasons why you're not expecting to have menses are you're pregnant, you're breastfeeding totally, feeding totally, and you're postmenopausal, or you might have a medical condition that causes your periods to stop. Regularly, menses are supposed to be normally every month, not painful. But if it's irregular, if there is pain, or if there are heavy periods, this may be a sign or maybe signs of a serious health problem. So when you have this, you got to investigate. Irregular periods can also make it harder, as I said earlier, to get pregnant. So we want to have regular, at least not so painful, although the pain, therefore, depending on what kind of pain you have, is many think it's a sign that you have normal hormones, so therefore you're congested, you have this, your uterus is working, your ovaries are working. So it's like if you have some pain, it's good. But if your pain is bad, persistent, becoming worse, then there is a problem. Okay? So we go to dysmenorrhea. Okay? Dysmenorrhea is painful menses or painful period. So this is part 1 in our abnormal or our menstrual problems. So menstrual pain, and the scientific name is dysmenorrhea. Okay? So dysmenorrhea is the most common problem for women associated with their monthly period. So somewhere in your lifetime as a woman, you're going to sort of have or experience the painful menses. This is due regularly to the release of pro-inflammatory agents during the ovulatory cycle. So you are releasing pro-inflammatory agents. So there's this pro-inflammatory agents, meaning you're gonna have inflammation if they are there. In a normal hormonal cycle, pro-inflammatory agents usually come about. Okay, and if there's so many release of that, you would have painful menses. Around 90%, a lot, right? 90%? Around 90% of women experience this. So it's a lot, 90 in 100, or 9 out of 10 women would have painful menses, and 15% are incapacitated during the first 1 to 3 days of their cycle. I was one of them, those people who would be incapacitated. I needed to be injected somehow so that the pain would would go down and I couldn't work because it was severely, my pains were severe. Now, you have two types of painful menses or dysmenorrhea. You have the primary dysmenorrhea, okay? It is related to prostaglandins or leukotrienes. These are inflammatory or pro-inflammatory substances in our bloodstream associated with the onset of our ovulatory cycle. So as you have ovulation, your ovary releases certain chemicals. Some of them prostaglandins, some of them leukotrienes, okay? The most common one, prostaglandin associated with your ovulatory cycle, is PG, prostaglandin F2 alpha. They are highest during the menstrual cycle. It is a potent muscle contractor. So it causes the uterus to contract, and it sort of like causes ischemia or lack of oxygen, and the uterus contracting very strong because of your prostaglandin F2 alpha. Some women also have COX-2 or cyclooxygenase enzyme increased activity. It's also an enzyme that is that can cause more production of prostaglandins and pain. You also have leukotriene synthetase, okay, that is also causes inflammation. Ovulation, ovulation, okay, effects on the ovary causes the release of this inflammation agent. So it's normal. The ovary releases these agents. Dysmenorrhea is rare, however, if you do not have men's ovulation, okay? Because we have the ovarian cycle, the follicles grow, and then you ovulate, and then they become small like this, and then you have menses. As that happens, waxing and waning of the ovarian cycle, the ovaries release this pro-inflammatory or these prostaglandins, these cyclooxygenases, and the leukotrienes. It's normal in a cycle like that. And it's rare, of course, it does not happen if the ovaries are not ovulating, okay? So if the ovaries do not have an egg because there's a problem in the HPO axis, then they have no dysmenorrhea, okay? But that's not really only the reason why some women do not have dysmenorrhea. Then you have the secondary dysmenorrhea. The secondary dysmenorrhea is caused by pelvic problems, related to pelvic problems like ovarian cysts, adenomyosis. Adenomyosis is when the lining of the uterus somehow gets into the muscles of the uterus. And when you have menses, they bleed into the muscle of the uterus, and it's painful. Endometriosis is the lining of the uterus outside of the uterus. So when you have menses, they bleed also. And fibroids. Fibroids are benign tumors of the muscle of the ovaries. So, the uterus, okay? So when you have fibroids, you have ovarian cysts, adenomyosis, endometriosis, you might have secondary dysmenorrhea. Most likely you would. And that manifests later. So primary dysmenorrhea, as it said here, highest prevalence during adolescent period, common, okay? Primary dysmenorrhea. However, secondary dysmenorrhea is in later in the reproductive years, so 30, 40 years old, regularly when they start to develop this one, okay? So I had primary dysmenorrhea that went into secondary dysmenorrhea. I'm such a blessed person with regards to pain. But so I understand, and I know that when you have dysmenorrhea, it hurts, okay? And if you have primary dysmenorrhea, I fainted a lot. We would have Citizens Army training, and we're walking in the field, and then, I faint because of my menses, and then the pain, etc. Then later on in my later life, I developed secondary dysmenorrhea because I had adenomyosis. I'm telling you my story, but anyway, it happened to me. It was severe that I had to be injected left and right, and it was like, hallelujah, when these things happened and were taken away. But that's not the end of the world, because there are natural remedies and they are effective, okay? And it's very important for us to understand that in dysmenorrhea, prevention is very important. This prevention is better than cure thing, right? So in the management and the natural remedies for dysmenorrhea, listen, ladies, 90% of us have dysmenorrhea, 15% are incapacitated. So if we take this seriously, we might just be able to to not suffer during menses, but it is premenstrual management. So you are working on it before the menses. Yes, especially after ovulation up to the 28 days. From day 14 of your mens, day 1 is when you have menses, and then you go 1, 2, 3, 4, 5, 14, you ovulate, and then 15, 16, 17, 18, 21, 22, 23. Those are the times when you are premenstrual. You have to be very, very importantly watching with hawkeye, because the management is here and it's crucial. Okay, so be particular about the food you eat. Have you ever noticed that when you're close to your menses, you open the refrigerator because you want to eat something, you're right? It's like you're craving for something. That's particular about the food you eat. You have to be particular because something is really funny, but you have to eat a lot of green leafy vegetables because it's rich in magnesium, rich in calcium, and they're the ones that cause relaxation of the smooth muscle. Okay? Not only for the uterus, but including even our blood vessel wall. So it helps. When you eat a lot of green leafy vegetables, you have magnesium, you have calcium. When you eat deep colored fruit and whole grains, they are anti-inflammatory. So before your menses, when your ovaries are starting to release this inflammatory stuff, you have to stop it by preventing it, eating magnesium, eating your fruits and vegetables and whole grains because they're rich in anti-inflammation. Get it? Yeah? Our food really is important prior to menses. It will control. So you go to the refrigerator and open and want to eat ice cream, think twice. You're going to pizza because you want to eat what we call it, Papa John or whatever. Think twice because you will suffer because you're not eating properly. So why? What's not eating properly? Avoid spicy. Okay, spicy, high protein, high fat, sweet, salty food. Isn't that the kind of food we want to eat? Right? When we're prior to menses, open the refrigerator. I want to eat ice cream. I want to eat something really tasty, very, very sweet, very, very salty. That's the food we crave for before menses. But it says, avoid these things because these things are the ones that invite pro-inflammation or throw gasoline in the fire of inflammation. Oh, it's easy. Just control your food. Be cognizant. If you're really wanting to eat, you eat it in the first half of your menses. I'm not teaching you how to cheat, but if you eat at all, you have to eat it in the first half. In the second half, be careful. Be watchful now. And also avoid caffeine-containing beverages and alcohol intake because they are also pro-inflammatory. And you have to increase fiber to enable regular bowel movements. Because if your poop is there and it's a long time there, congested, there's congestion there in your uterus already, and you add congestion in your pelvis because you're not moving your bowels regularly, it adds to the pain, it adds to the inflammation. So increase fiber intake. And where do you get fiber? Green leafy vegetables, deep colored fruit, whole grains, not in the meat, spicy, sweet stuff, salty stuff. There's no fiber there. So be careful with the food you eat. Another natural remedy, which is crucial and preventive, is moderate exercise. Not carrying heavy stuff, not going and pumping iron. Moderate exercise, especially during the premenstrual. So it's also in the second half of your menses. Important second half of your menses. Okay? So you have to exercise to get strong abdominopelvic muscles and bones. So you know the bone structure here, your muscles there. You have to exercise this one as well. So crunching up like this, and your abdomen and including your pelvic muscles, they will help push away the blood from the system, and congestion is lesser. Okay, you have less congestion, and you have to exercise your back. Usually when you have menopause, when you have dysmenorrhea, it's your back that hurts a lot. You press on the back, and then also here in the front. So you have to exercise your abdomen and your back. And there, abdominal wall exercises, and then you have knee chest. So you put your knee to your chest, and then you exercise your pelvic floor. The Kegels exercises. You sort of like the Kegels exercises. You're pee in your mind. You're peeing, and you cut your pee, and you hold it like this, and you hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then longer and longer until it become regular for you to be holding your pelvic girdle up like this. So when you do that, you are pushing away the blood from and the inflammatory chemicals from your bloodstream out of the pelvic area, and you would have lesser pain. Okay, always be cognizant of your work on posture. You have to be like straight body, okay? Like always straight body. Avoid pressure. Because if you're doing like this, you're pressing on your abdomen and it's pressing on your pelvis. But if you're sitting upright like this, you're relaxing this area here, and there's no pressure on your pelvic cavity. So work on your posture, avoid pressure on the abdomen, avoid folding your arms like this on your. You're pushing also your abdomen down, like abdominal contents down on your pelvis. So avoid folding arms. And there's what they call the mindlessness of posture may result in retroversion of uterus and other malposition. You're just like this. You don't really care about your muscles in your pelvic girdle, in your abdomen, and in your back. And your uterus changes position. Normally the uterus is in my pelvis like this, okay? But because I don't really care, it goes like this, it goes like that, it's being pushed out of place. And when your uterus is pushed out of place, there's kinking of blood vessels in the side, and you have congestion and pain. So be mindlessness of posture. Now you have to be thinking of your posture so that when you're upright like this, your uterus falls forward, and that's the normal position of your uterus. Mindfulness of your position, not mindlessness of your posture. So we have some more natural remedies. Care for mental health. You have to be, it's a lot of normal remedies, natural remedies, but you have to work on them. And when you work on them, they become habit, okay? So when they become habit, it's just every month it happens like this, and you get better and better as the months go. So how do you care for your mental health? Avoid stress and stress management. Okay, so when I was younger, I always I had a very short fuse. And so, and especially when you're towards menses, you feel you're angry, you're waxing and waning of your hormones. You can't control, you're angry, you're irritable, emotional situations. So you don't put yourself in situations where you can get angry. Okay? Avoid stress, avoid emotional situations. So you don't fight at the time, around this time where you're having menses, because you can, prior to your menses. Well, one of the things my mom told me was, do not read novels, okay? Because novels are highly stimulating. And Mills and Boons, she loves the boy. Oh, the boy loves her. And what's going to happen tomorrow? And we read, and you don't sleep through the night because you want to finish your book. Highly stimulating books and articles, they wreak havoc on your stress and your mental health. So be careful. And watching movies too, right? We want to watch movies all the time and stay late watching movies, wreaks havoc on our mental health. Also toxic relationships. But to be careful. Is why do we get into toxic relationship? We have a boyfriend who's hitting you, or a boyfriend who's telling you is trying to control everything you're doing. Stay away from these things like this. So you don't get you protect your mind. So you can think clearly. You're not, they call it aburrido, bored, or angry. This helps your mental health, which can be preventive of dysmenorrhea. Now, you have to endeavor to have a regular daily schedule. Okay, our body normally works on regular and predictable processes. So, menstrual cycle, regular, ovulation, regular. Our body goes on a regular cycle. We work with that. Avoid things that are spur of the moment. Oh, I like to do this. This is my major. Let's go there, do this. Let's go there, do that. And we come home so tired, so stressed up, so toxic minded. Okay, we have to wait, we have to check because regularity helps your menstrual cycle come and work better. Okay, so it's important that we sleep early, that we have a good sleep pattern. Sleep helps your mind recover from stress. Sleep removes the gunk from your brain. You know, when you sleep, your brain takes away all the gunk that accumulate throughout the day for whatever your mind was thinking, whatever processes were happening in your brain. There's waste products. It's when you're sleeping that the waste products are removed. But when you're stressed, you think about it, you cannot sleep, and your brain cannot remove all these waste products. You got to sleep to remove these waste products. On top of that, when you sleep, you learn things better. So, who does not want to learn things better? You want to become better? You want to be able to memorize these things? You want to be able to work these things? Why not sleep, right? Sleep is important even for your menses, okay? So, some more natural remedies, outdoor activity. Why outdoor activity is important? Sunshine and vitamin D. Now, vitamin D is only a small portion of actually of the, what do you call this, of the what we can get from sunshine, okay? Vitamin D is a small portion of what sunshine does for us, but it is important. Okay, so vitamin D is what we need. And outdoors gives us toughness of fiber, strength of constitution. Use sufficient warm clothing to keep the limbs warm. Now, there is this study, okay, here, where they studied 77 women, and they found out that 60 of the 77 women, I don't know how many percent, I should have worked on this, but 60 of the 77 women had vitamin D lower than 30. In other words, their vitamin D level was low. That's a lot, right? 60 out of 77. And only 17 had a level greater than 30. And they're not even telling you how much greater it is. But they found out that if you had low vitamin D, you had 40% long cycles. In other words, you're going to bleed longer if your vitamin D is low. You don't want to have long cycles. You become anemic from bleeding, okay? And then you just imagine the discomfort that you have bleeding on longer. So when your vitamin D is longer, you have longer cycles, you become abnormal in menses, it becomes farther apart, and then sometimes 12% you do not have menses at all because you have your vitamin D is very low. However, if your vitamin D were normal, okay, then it was only 12% reported menstrual disorders. So if your vitamin D is normal, most likely you would have no menstrual disorders. Only 12%. 6% had further apart menses, and only 6% had absence of menses. So vitamin D is even helpful for your menses. You thought it's only for your bone? No, it also is for your menses. Okay, so let's go out. Now, sunshine, however, also is, the sun that enters your eyes is like a recharge of battery. So have you noticed that if you go out in the sunshine, you feel good? And it's like you got a recharge. You go to the beach and you enjoy the whole day. It's like 4 days of feeling good because you have energy, you charged yourself. If you just stay inside the room, no light, just under like this artificial light, it's not doing you any good. You have to go out and recharge yourself. So it's good for you to go out. So another thing for outdoor activity, aside from sunshine, is of course fresh air. Okay? The outdoor air is rich in what's negative ions. Okay? You know, negative ions are negatively charged ions, and they take out the dirt. The the pollution in the air is positively charged. So if you're out there in close to rivers, close in the mountains, or in the forest, there's a release of negative ions. What can we do if we're in Central Valley? We are regularly not fresh air. We have a lot of negative, positive ions floating in the in the air. So we got to go out where the air is fresh, where we can get negative ions, because negative ions increases our strength. It helps our breathing better. Keep sufficient. We have to fresh get fresh air. It's good for your system. Increase the strength of your constitution. It is very important also, okay? Okay, this one is so fun. I like talking about this, okay? So, proper clothing. Oh, even clothing has something to do with your dysmenorrhea, right? It does. Because when your limbs are exposed, your blood vessels constrict and all the blood come to the center of your body. Okay? So there's pooling of blood in the organs in the middle of our body, our core. So including our pelvis. So you're already prone to dysmenorrhea, and you're wearing in during cold time, or you're air conditioning and wearing short pants in the air conditioning. Our extremities will get cold, chilled, and our blood will be pulled into the center of the body, and you will become prone to dysmenorrhea. So clothe yourself properly. Cover your extremities so that the blood will be circulated throughout your body evenly. Oh, it's very important. Avoid also tight fitting clothing like, woohoo, wow, sexy, but okay. So avoid tight fitting clothing, especially around the waist, because you are keeping the blood from returning back to the heart. If you're cutting it, like it's like you're putting a tourniquet around your waist, and not allowing blood from the lower part of your abdomen to go back into your bloodstream. So you would have congestion, and therefore you'd have pain. Oh, you don't want that, right? So it's better for us to have like proper clothing, warm extremities, and avoid tight fitting clothing. So we go further. We have hydrotherapy. This one for me is very, very interesting. Hydro meaning water, and therapy. So I was told by one of my mentors. I had trained in Wildwood Lifestyle Center, and I trained under, sort of like listened a lot under Dr. Agatha Thrash. And she told me that hydrotherapy, especially ice cold sitz bath, is very, very helpful pre-menstrual. Because when you put your it's your whole butt in the ice cold up to this big, what do you call this, basin with a lot of water and ice, and you sit your butt in that cold ice. Okay, when you do that, it constricts all the blood vessels in this area and pushes it out of your pelvis. And when you do that, all the gunk and all the congestion in the middle part of your body, a lower part of your body, is released. That's only prior to menses, not every day, okay? Only around the time where you're almost going to have menses. Or if you can't deal with your butt being frozen in the ice water, you can use ice packs, okay? And prior to menses, when you put the ice packs in around the area of your pelvis, you're pushing away the blood. It's a less drastic one. But I believe ice cold sits really works very well, not only for dysmenorrhea, because it really also works for other problems as well. Then also you have hot foot, hot half baths, okay? Or hot foot baths. So it's half of your body warm, okay? When you put your body in that kind, half bath only half of your body down in water, or your feet in hot water, you'll increase your temperature throughout your body, and there's an increase in circulation and increasing circulation throughout your body. I think this will also work because I've seen this work as well. Uh, but I've seen hot sitz bath more, uh, ice cold sitz bath more working than hot foot bath or half a hot half bath. Then you have herbal supplements. So we don't regularly do that, right? But instead of taking aspirin or taking ibuprofen or taking Tylenol and all those pain relievers, you can take herbal supplements that can help you deal with the pain. Okay? So you remember that inflammation is one of the causes of dysmenorrhea, right? So ginger and turmeric family, they are very strongly anti-inflammatory. So you can buy the prepared product already in capsules or whatever if you want to. But you can even take it also as raw. Make your ginger tea or your turmeric tea. I take turmeric powder, and because I can't stand it to be drank, I put them in capsules, and they help me with my inflammation if I do have inflammation. And you can also use the basil family, the basil, mint, etc. Those different basil family, they are muscle relaxants. If you you can what do you call this? Mash them and put them as a poultice here, in your abdominal wall, just here in your hypogastric area. They will be absorbed into the bloodstream, and they are strong muscle relaxant. I had one consultant who would put the mashed basil family, like chamomile and etc., all this mint, inside the menstrual pack. They take out the inside and they put the basil in there, like as in a poultice, and they put it there in the prior to menses, okay? And it's absorbed into the bloodstream. It is anti-inflammatory aside from muscle relaxing. Then you have chamomile, coriander family from flower, seed, and leaves of the stem. They are very highly muscle relaxing and anti-stress, and anti-inflammatory. So I think chamomile and coriander would be good for dysmenorrhea. And you take it prior so that it will take out all this before it even starts. So because prevention is better than cure. Then you have red raspberry, which you can take as a tea, hormone-like properties, and it helps normalize your hormones. So it's good for you. Okay? So these are the herbal supplements that you may use for your problems. Now, however, if you tried all of these and your pain is becoming more and more, mine was like that. It became worse and worse and worse over the years that I became like, inutile. I cannot do anything. So I had to seek the consult from a doctor. Okay? You have to do that because there can be tumors that are in your pelvis that are causing inflammation, are causing blockage, and you need to rule that out, because if you have pathologic causes that are in your pelvis, you have to deal with that. Okay? So pelvic or hypogastric pain occurs unrelated to menses. So sometimes you have pelvic pain that's not even related to menses, and you're saying, maybe this is related with. It's not related with menses. You got to see a doctor. It may not be associated with your uterus. When the use of pain relievers do not help, you're taking all of these already. You're taking your pain relievers, they're strong, and you're taking your herbs, they're strong. You're doing everything, and yet nothing is working. You got to seek help. Okay? So when the pain gets in the way of daily activity, that's what happened to me, right? I was suffering so bad. I would sit down on the toilet bowl crying. Okay? It was like something is going out of my pelvis down there. I was crying and I had to seek consult, and I had to deal with that. It is really. And then if you have blood coming out that are clots, big clots, you would become anemic soon if you have menses like that all the time. If the clots coming out are bigger than a penny or a quarter, you have to seek consult because you might have problems other than just this primary dysmenorrhea, and it might be problematic secondary dysmenorrhea. You got to see your doctor. Now, these are the regular things that they do for allopathic, means the regular doctor management, the regular consultation. They would give you hormones for birth control so that you don't have menses. And if you don't have menses, where's the pain? Because you're not having menses. The problem is you can have side effects from your menses, from your hormones that you're taking. Some can be a shot, like the Provera, they inject you, and it's for 3 months, you don't have your menses. So it's like alleviated dysmenorrhea, but the side effects are there. Pills also, birth control pills, they can be also, you also can have the hormonal IUD or the vaginal ring that releases hormones, and it affects it's like a hormonal birth control thing, but it's the IUD and the vaginal ring. And maybe if nothing is happening, even if you're doing all that, surgery may be necessary, but that's the last resort. You don't do removal of uterus for only a primary, okay? A primary dysmenorrhea. However, if it were secondary, you got to do something about it. Treatment depends on what is causing your pain. Your doctor may prescribe hormonal birth control and all these, okay? When you're not having menses because of hormones, shot, pill, and the IUD or the vaginal ring, you're not having menses. The problem is when you do not have menses, you don't have estrogen. And when you do not have estrogen, your bones become osteoporotic, right? Sooner than you want. Okay, so maybe many times you might probably just need surgery. So you got to get professional help to end your problem of dysmenorrhea. Dysmenorrhea is incapacitating many times. Okay, we thought we know it's 15% of those who have it. But you don't need to be suffering if you try all these natural remedies, because they do work. You're asking for a miracle from God, He shows you a natural remedy. And when you do the natural remedy, He says, if you do my laws and my statutes, I will not give you the diseases of the Egyptians. So when you do a lifestyle that is healthy, your body will rally with you. So you don't need to be doing the wrong stuff. You can start doing the right stuff so that you can become healthy. And instead of your husband caring for you, you can now care for you, your husband, and your children instead of them watching you suffer. But God is good, right? There are always things that we can resort to, and we can always ask for help. Pain is something that the body does when it is telling us that there is something wrong. So if we deal with the pain, take pain reliever, pain reliever, pain reliever, and we don't take care of what's causing the pain, we might end up problematic, right? Because we're pushing away the cause. We're not catching the diagnosis. We got to catch the diagnosis so we know how to manage the pain. Okay? So menstruation is a gift, but there are problems. And this is the problem that we have, dysmenorrhea, for the first part of the menstrual abnormalities. So we will have the next part, which second part, which would be abnormal menses, absent menstruation. That's the second part. And then the other one is profuse menstruation. That will be in our next topics. So I hope you learned something here so that you don't need to suffer, and ask God to make you more consistent in your trying to fix these things, because you will be able to deal with this. It is very doable and very effective. So let me pray for you, sisters. Let me pray for our families that are suffering like this so that they can deal with their problems if they do have. Shall we bow our heads? Gracious, loving Lord, our mighty Heavenly Father, I can imagine, I can only look back in time and see you bending over when you did the surgery on the side of Adam to take out the rib. And you were thinking, I'm going to make this rib into a woman that's going to love her husband, that's going to be a helper fit for her husband, that's going to make the relationship perfect in the Lord. You look back, I look back and see you bending over. Gracious Heavenly Father, you are truly wonderful. You knew what you were doing. We're so sorry, Father, because we have fallen short so many times. We don't eat properly, we don't exercise, we do not sleep, we do not take care of mental health, or so many things that keep us away from having a healthy body. Father, forgive us. Help us to work better at making our bodies healthy. We give ourselves to you, Father, so that we can be used mightily. We know women force is mighty. We can do what you want us to do. We can bring things to happen that men may not be able to do, Father. So give us the strength to follow your word, to follow what you want us to do, so we do not put toxic things in our body. We do not continue in the bad habits that we have, because we want to present ourselves to you, especially because you're coming soon. We want to be ready. We want to be holy, whole, not without this, without that, in pain here and pain there. We want to be able to present ourselves to you whole. Thank you so much, Father, for hearing and answering our prayer. Thank you for your grace and your mercy. For Jesus' sake, amen.